Charles here, he's complaining of some hip pain in the front. When he's doing things like leg lifts or hip lifts, it's really bothering him, especially as we get in through kind of this like medial hamstring portion, so in through the adductor magnus. So my guess is that it's going to be a hip capsule adductor magnus issue. We'll check to see what that is relative to his hip flexion. If his hip flexion is full, it's probably going to be psoas. If his hip flexion is short, it's probably going to be what I just mentioned, so hip capsule and adductor magnus. So we'll take him through our supine hip flexion test. Rib cage is right there. Let me know when you start to feel it on the front, Charles.
Sure. Right around there.
Right around there. So he's definitely short. There's his rib cage. He's about 3 fingers, which is 77%. So that's a C+ grade function. How about when we do this, Charles? Anything crazy there, or just a general light stretch?
No,
just general light stretch. Okay, so I'm going to predict that this is going to be a hip capsule and adductor issue, so I'm going to work on the adductor first. We're going to palpate, then we'll use the shockwave, pressure wave, whatever, to try and break some of that scarring down. So I'm just going to pull him down here, just start to push around. We've got some soreness there, right, Charles?
The second spot, actually.
So more down here?
Yes.
Okay. And I'm feeling it all the way up in through here as well. Awesome. And then it gets nasty as you get really, really low. Like that's not a fun spot, right? Okay. Right now we're going for that adductor magnus. It's a hybrid groin and hamstring tissue. And it correlates with one of the areas of chief complaints that he's experiencing, right? A lot of the knotting in through the hamstrings. So we'll start nice and low. Right? We don't want to get too much of this. Perfect. How's that? Yeah.
Tolerable.
Tolerable but sore, correct?
Mm-hmm.
Good. More sore? Okay. How's that?
Good. Tolerable.
Something there.
The second place, yes.
Second place was more than this. How about there?
Yes.
Yeah. So I'm just trying to grab more range as we break stuff up. When you break the scar tissue down or the adhesion, you get more range of motion. So I'm just trying to consistently take up slack. How's that?
Better.
Better. I'm asking him how it feels, just because if it's sore, there's usually scar tissue there. Now what we'll do is we'll circle back to the worst spot that I found. You can see his face, he's not really enjoying it. And then we'll slide up to the worst spot that he talked about. And again, getting more and more range. Sorry, Charles. Sorry, Charlie. There's the crummy dad joke of the day. This might be on YouTube, so I don't want to swear. Good. 3, 2, 1. Perfect. Good. 765 pulses at a level 6 is nothing to scoff at, right? We'll remeasure. Let me know when it starts to pinch. Right there. Good. So he's about 1.5 fingers, which is close to about 90%. So now we're going to go into the hip capsule, try to get him from 90 to 100. So let's have you roll onto your side facing that way, Charles. Good. So very, very sore there, right? Just a palpation you can feel. So this is the hip capsule, right? We'll actually go ahead and we'll use this thing here. So it's actually this ligament right here, basically going to go from the femur to the acetabulum. Charles, you've seen this a bajillion times, but we're treating this spot from here to here. When it comes to Shockwave, it's most effective when the tissue is under tension. So we want to lengthen that ligament as much as possible. And how do we do that? We flex his hip, right? Because that ligament's got to go from here. When we flex that hip, widens out, and then we'll actually internally rotate, which will get a little bit more lengthened through there. So there's kind of the visual for that. Same thing here, we'll go level 6. Right there. Right?
I think a little bit to your right.
To my right, like here?
Yes.
Beautiful, good. So I'm actually gonna mark this one. So our worst spot was right there, correct?
Yep.
Beautiful. So we'll X marks the spot there, and we'll actually work all the way around this capsule, right from there to there. Good, put him under some tension there. Good. How's that feel, Charles?
Good, tolerable.
Tolerable? Sore there?
A little bit. Yeah.
A little bit. More there? This would be it? Okay, perfect.
Do you want me to flex with you internally?
Nope. Nope. I want you as relaxed as possible. So a lot of people spend a lot of time working internal rotation. We can get you more internal rotation in 5 months than you can probably get yourself in, or excuse me, we can get you more internal rotation in 5 minutes than you can get yourself in 5 months. Sore there, Charles? Yeah? Yeah, it's a good spot. That's it, okay. About 100 pulses on this spot, and that should be it. Final measurement here. Let me know when it pinches or you don't want me to go any further.
Yep,
Right there. So he's right at the end, probably between 95 and 100%, which is awesome. So we got you a good 20% improvement in about 10 minutes. So if you're experiencing hip pain when you bring that hip up, when you go to flex, most likely it's going to be a hip capsule and an adductor magnus issue. If you get pain when you extend, that's where we're most likely going to get a hip capsule, or not a hip capsule, a psoas or an iliacus or a femoral nerve issue. So hope that helps. Have an awesome day, guys. Thanks.